Hello, health enthusiasts, and welcome to Rev Up Health, your go-to podcast for all things wellness. I'm Dr. Mark Heckler.
And I'm Tandi Heckler. Together, we're here to fuel your health journey with the best of functional medicine and holistic well-being.
Each episode will dive deep into topics that matter to your health, bringing you the latest insights, research, and inspiring stories.
So whether you're on a quest for vibrant health or just looking for daily health tips, we've got you covered.
So let's embark on this journey together and transform the way you live. So Tandi, what's on our wellness radar for today?
Hello, and welcome again to Rev Up Health Podcast. I'm Tandi.
And I'm Dr. Mark.
And today we wanted to visit a little bit about a comment that we got on one of our posts on social media recently. And the comment was a great one, and it talked about accountability being a really important part of the healthcare equation. And that just really stood out to me. There's actually more than one healthcare equations, and I want to talk about both of them separately today. The first one is the healthcare equation, meaning all of the different pillars of health we have. We have physical health, mental health, emotional health that kind of goes with mental health, financial health, social health, sexual health, and spiritual health. All of these things are a part of a person. And whenever one is a little bit out of a balance, it's affecting other areas. So that's one piece of the healthcare equation. And the second piece is how much we put on our providers versus how much we put on ourselves.
Right. Because I can tell you that I can't tell you how many times that I will walk into a room and I always start by, introducing myself and say, hey, how can I help you today? And the first thing that comes out of a patient's mouth, I don't know, you're the doctor. So that tells me that, they're wanting to have a quick fix. They're wanting me to understand everything and wanting a simple medication or something to just take care of the problem and then go away. But that doesn't give them accountability for, what are they going to do for themselves? What are they going to do? How are they going to carry through with whatever suggestions or advice that I may have for them?
And I think that's something that comes up quite a bit is patient compliance. In healthcare today, providers are held to a pretty high standard, and patient compliance isn't really taken into consideration in that. A provider can give all of the information and the good advice, but if the patient doesn't take that home and act on it, it's not really the fault of the provider, but they get dinged from a quality measure for it.
Yeah, I'm sure that, and probably a lot of the physicians out there can kind of answer to this too, that, you may tell patients something, but majority of those patients, probably 80% or even higher than that, 80 to 90%, won't follow through with everything that you want them to do because they just don't want to change their lifestyle. It cramps what they already do, what they've been doing for years. Well, how's that done for you? So you're still metabolically unhealthy. So, at this point, I try to emphasize that, I'm a small part in this equation. We are a small part as providers for an equation for the health of a patient. At this point, I always suggest that they are 80 to 90% of the equation of getting themselves back to health. And we're only 10 to 20%. We have answers, we have suggestions, and we have ways that a person can reach a healthy state, but it is totally up to the patient to fulfill that and to carry through. And truthfully, most of the time, they don't need me or us or anyone at that point from a healthcare standpoint to tell them the right things to do. They already know the right things to do. They just don't carry through sometimes, and it's hard to do.
And I would say that the healthcare organization, or I don't know if you would call it organization, but our healthcare system has really taken that empowerment away from patients because there's all of this scientific information that says follow the science and do these things, and go see this specialist, and nope, you have to see this specialist for something else. And so we've really created a situation where we've taken the power away from the patient and enabled them to feel like your doctor can fix everything that you need to have fixed.
Right. With a simple pill or a simple shot, or you take this round of antibiotics and that takes care of it. But, it doesn't. If you continue down your same lifestyle pathway, whether you're eating the processed foods or you're not putting forth the exercise activities, these types of things continue to plague you with chronic disease.
Right. And I guess what I'm saying is that we've kind of set patients up for this a little bit. So there is,
true,
to some extent, saying like medicine, healthcare has set patients up for this somewhat.
Right. But you're also as a patient, you are seeking the advice and the knowledge of that provider to give you that information so that you can correct your problems. So that is, still the providers to be able to give them that information so they can actually heal themselves.
Yeah, I think that is very true. I think another piece is remembering that we can listen to our own body, and we really are very in tune. If we take the time to listen, we can figure out a lot of things for ourselves, which I think is one thing that I really love about nurse coaching. Is a lot of what I do as a nurse coach is help patients rekindle that connection with intuition and listening to their own body and kind of
guide them on their path, not maybe direct them necessarily, but be there as a cohort to help them kind of navigate their own problems.
Absolutely. It is 100% a collaboration. It is not a one-sided, this is the exact thing. As patients, we know what the most important things are to us. And, once we identify that starting place, it's going to continue to funnel into the other areas of our health.
Yeah. And then also we live in a world of instant gratification. Everybody's got a cell phone, everybody's got a computer, everybody's got internet, not like the old days where you had to go to the library and look up the encyclopedias to find your answers or do the research and go through the card files. That's old school, but, and some of you know what I'm talking about. But, now with an instant phone at your fingertips in your back pocket constantly, your thumbs can do the walking for you and you can find anything you want. And that's also spilling over into everything, whether you're in healthcare or whether you're going to Walmart or you're going to the auto parts store to get something. It's just, you want it and you know where you can find it and you want to get it now.
Yeah. And that can actually be a double-edged sword sometimes, I feel, as far as empowering patients with the information of Google and Dr. Google, so to speak.
Yeah. WebMD. Yeah.
Having patients come to you and say, here are the things that I have diagnosed myself with, and this is why. And
right. That's exactly right. Because I have so many patients that come in and say, well, I've got Meniere's disease, or I've got this problem or that problem. And okay, well, what are your symptoms? Well, they gave me this for that. Okay, well, why did you get an antibiotic, or why did you get this medication for it? So it's, I don't want to know really what they got. I want to know what their symptoms are. And that's really an issue also, I think, from a patient standpoint, is that patients aren't heard. You go to the doctor for something, or you go to a healthcare provider and you're trying to get an answer, but they don't always listen. And if they would just sit down and listen to you, 90% of the time, I can diagnose a patient without even touching them or listening to their heart or lungs or looking in their ears or anything. You just listen to the patient and they're going to tell you what's wrong. And then you can literally make a diagnosis sitting in a chair listening to them. So, and I can tell you, majority of the time, to 90% of the time, I sit down to talk to the patient and I already know what's going on as they're telling me their problems, their symptoms. And then further questioning, all I do is confirm what I've already thought the situation was.
I think you look at the health system, healthcare equation. And you've got the patient, the provider, and then you've got the insurance company, because they do.
Right. The insurance company, unfortunately, has control over how the money is used, in healthcare. And so they also have a big part in that, because there are multiple times where we may suggest a surgical procedure or a grouping of procedures or tests that need to be done. And yet the insurance company may, legitimately review it, or just simply pull it out of a hat and deny, that test, or deny that one of those procedures. So that also is an important part of the equation. You're right.
It is. Like, I think even to draw a vitamin D level, you have to have a certain ICD-10 code,
right,
to qualify the patient for vitamin D, which most of us are deficient in.
Yeah. Over 80%. And even, testosterone levels, if you're not over 300, they don't even consider treatment options for you unless you're at least at a 300 level.
Right.
Or under 300, yes.
So, the patient, I think in current state, a lot of people have the perception that the provider is 80, 90%. I don't think most patients know how much insurance plays into their equation. But
right. They just hope that everything's paid for.
But anyway, heavy on the provider, less on the patient is kind of the mindset that we've fallen into. But I think the way that we are looking at healthcare is more, I would like to take insurance completely out of the equation.
Right. Yeah. Wouldn't it be a great world if we could do that?
I don't think we have a good solution there, but
I don't think that science fiction tale is going to happen very soon. But, what is compliance? What's the definition of patient compliance? We're looking at it's defined as the degree of adherence of a patient to prescribed diet or treatment, whether or not the patient returns for reexamination, follow-up, or treatment. So, in medicine, compliance describes a lot of that to the degree to which the patient correctly follows their advice.
Yeah, and I think compliance runs along there with accountability. I think those are kind of interchangeable, like the patient being accountable for their end. So what would you put, we already talked about this a little bit, you spelled it out. You really think that provider is more like 10 to 20% and patient is really ultimately 80 to 90% of the healthcare equation.
Right. Whether it's following the correct diet or taking your medications for your blood pressure.
Nutrition.
Getting your nutrition. Right. Yeah. Diet. We got to get away from that word. Diet is a bad 4-letter word. I've said that multiple times. You've heard me rant on social media. I say that too. But it's just hard not to say that. But nutrition is really key. And unfortunately, there's a whole nother podcast on that too. But, with big food and pharma, that is really downwarding spiral. We'll cross that bridge on another podcast. But that is a big influence on how folks basically eat, how patients eat and what they consume. And then, likewise, down the road, it deals with what kind of chronic disease they're going to develop too.
So the other piece of your healthcare equation, I think, is more just looking at that holistic part of a patient, like the entire body and all the systems that are influencing your overall health, and remembering that every piece bleeds into the other. If your financial health isn't great, then you may not have the means to get the nutrition that you need, or, have that access to a workout facility.
Even the physical ability to get to the workout facility, or even to get to the areas where you can exercise or go outside to even walk. Exactly.
Yeah. And the social, this is kind of where accountability, like this is where we kind of mesh into the other equation, is it is so much easier to be accountable and compliant when you're able to surround yourself with people who are like-minded and have the same goals.
Or supportive.
And are supportive.
A family, a good supportive family is a huge deal. If you're trying to quit smoking and your spouse is not interested in that, it is really hard to stop. Same thing with eating and diet and what your nutrition is. So, it's, if you're not good stuff and, or somebody wants to go out and get pizza, well, okay, well, I guess we'll have pizza tonight. So you may have other things in mind, but in good social networks, it's difficult to keep motivated for that.
And that is something where I think, luckily, as a coach, you can provide that accountability in this kind of a practice that we're working in. There's a little more time as providers for us to help along with that accountability, more so than your primary care who's, seeing patients in and out every 10 minutes and doesn't really have the bandwidth to provide that accountability. We, email reminder of, hey, don't forget about this, or, actually saying, hey, send me your blood pressure readings next week and I'm going to look at it and we'll talk about it. Or
a diet plan, nutrition plan, send me what you eat each day, your breakfast, your lunch, your dinner, and we're going to go over that and see if we can't help your type 2 diabetes improve a little bit. So that's a difficult problem.
I feel like we should use one of those bells we have around here, and every time we say...
When I say diet, I'll ding it. I'll give you $1 every time I do it.
Oh, this could be good.
So, but yeah, I don't know, it's a difficult situation to try to figure out how best to, as a provider, to have patients become more accountable. And yes, there's accountability on a provider to provide that information or that prescription or that game plan and make sure that the patient follows through with it. A lot of times you can suggest it, but okay, well, I'll see you. If you have any problems, let me know. And that's a difficult thing to do.
Yeah. I also think in today's age where everyone is reviewable, sometimes as a provider, it's hard to want to say the hard things and hold people accountable for fear of, a bad review too.
Yeah.
So I think it's definitely a time of transition where we can explore what this new landscape looks like in healthcare.
Right. Yeah. I think if we can all come to an agreement to, unfortunately, I'm backing up a little bit here, but unfortunately, the insurance arena that we work and live in is also a pretty significant driving force. And, what we say, what we suggest, and then how that's followed through also. So some of these things, it's okay, well, it's not covered. I'd love for you to do this or A or B, but it's not covered on your insurance, or this medication's not covered on your insurance. So, or it used to be and now it's not. So those types of things influence, behaviors and outcomes also.
Yeah. I mean, you just touched, you may have just opened Pandora's box there, because that is actually kind of a huge piece of patient compliance. Mm-hmm. Patients saving their insulin because they're afraid they're going to run out, or can't take a medication anymore because they can't afford it.
Yeah. I mean, insulin used to be very expensive and it's coming down, but it's pricey, and it's not like you have an option. You don't have an alternative if you're a type 1 diabetic. You have got to take it. So but the type 2 diabetics have other options, and then there's the whole weight loss ball game that we'll cross in another podcast too.
So ultimately, there's a couple different ways to look at the healthcare equations. And I think from our perspective, we're looking at a way that we can help and be a better advocate and supporter of the patient so that they can truly be 80 to 90% of the healthcare equation, and we can fill in our 10 to 20%.
Right. And it's kind of on us to not, maybe not prescribe the most expensive medication out there or the most expensive test, or, try to treat the patient instead of, make the insurance company happy, for instance, ordering the test that they'll pay for. So, not every test is going to tell you an answer you want. So.
And that is another way also to take into consideration the whole person and that piece of the healthcare equation, and really taking the time to know not only what is the physical status, but what are the mental, emotional status? What is the social, spiritual?
Right. The whole picture.
Yeah, the whole picture. So that also needs to be used when providers are making recommendations. So I think that's our goal.
Right. So, our goal was to try to, help people navigate through their health needs, listen to the patient, try to make a doable path. We can't throw everything at somebody at one time and expect them to get it done. It has to be taken in small bites. You can't sprint through a marathon. You got to take it in small sections to get through those types of things. So I think if the patient and the provider are on the same page, I think it's a whole lot easier, and they're going to have a lot better compliance in the long run too.
So that was a good visit. Thanks for joining us.
Yep. So if you have any questions or comments and want to reach out to us, you can reach out to us at revelationhealthandwellbeing.com, or, keep listening to the podcasts. Or we do this out of purely educational support and just love to provide, free education information for folks to give them better health choices. Thanks for joining. Have a great day.
Thank you for tuning in to another episode of Rev Up Health. We hope you're leaving with some valuable insights to supercharge your health journey.
Don't forget to follow or subscribe to Rev Up Health wherever you listen to your podcasts. And if you enjoyed today's episode, please leave us a rating and review.
Have a topic you want us to explore? Reach out to us on social media channels. We love hearing from our wellness community.
Until next time, keep thriving, and remember, your journey to health is a journey to a better you.
Stay well, and we'll connect with you again soon. This is Tandi.
And this is Dr. Mark, signing off from Rev Up Health. Take care.
The information provided in this podcast is for educational purposes only and is not intended as medical advice. The content is designed to support, not replace, the relationship that exists between a patient and their healthcare provider. Always consult with a qualified healthcare professional before making any changes to your healthcare regimen, including diet, exercise, or treatment plans. The views and opinions expressed in this podcast are those of the hosts and guests and do not necessarily reflect the official policy or position of Revelation Health and Wellbeing.